With that, ladies and gentlemen, it's time we kickstart with the officials of the day. I am absolutely thrilled to announce our first panel. We'll be talking about technology and innovation in healthcare, delivering healthcare beyond physical boundaries. Well, of course, this is not an everyday discussion. This is a glimpse into the world of technology that is meeting healthcare in the most awe-inspiring ways imaginable. I'm sure it's going to be a fantastic conversation. So without any further ado, I would like to introduce the panel. Mr. Girish Raghavan, Vice President, Digital Platforms and India Technology Center, GE Healthcare, joining us for the first panel discussion. I'll request all of you to kindly welcome the gentleman with a round of applause. Joining him is Mr. Suhel Bidani, Lead Digital Health, Bill and Melinda Gates Foundation, India. I'll request all of you to welcome the gentleman again on the round of applause. Wow, I thought we served you coffee and tea and everything else outside. You need to slightly put your heart into the applauses. That'll be great, yes? Please welcome Mr. Jay Ramakrishnan, Head Amazon Pharmacy, joining in. Dr. Sabine Kapasi, Gynaecologist, IVF Specialist and Public Health Leader, UNDAC and Geneva, joining us as well. And the moderator for this session is Mr. Sayantan Chatterjee, Executive Director, PwC. I'll request you all to kindly welcome the whole panel with a bigger round of applause. Mr. Chatterjee, it's all yours.
Thank you. Good morning and welcome everyone. It's always a pleasure and also a big expectation, especially after hearing the Honorable Minister talk about in such simplistic words. And so when we talk about digital health and some of the things really struck a chord, and I'm sure I'm not the only one. So sitting in this, as he said, that Panch Sitara setup, talking about digital health, talking about a setup which is not just the confines of this conference room, or for that matter, the Luton, Delhi that talk about. Something which is as fundamental as health. Something which I believe, I would say is fundamental, if not a right, something which is fundamental for every human being to exist. And the way he said that, be it a minister, be it a person on the road, be it a rickshaw puller, it's something which is fundamental for everyone to live and coexist. So it's my honor and pleasure today to be talking to you, and I won't say moderating, I would say facilitator. And we have a very honorable, I would say, panel with us. So I will not waste time in terms of introducing them, because they're all stalwarts in their fields of work, in their respective, I would say, areas that they basically look after. And in some way, they're all connected with that passion about how do we make healthcare more reachable, something which is more affordable, something which is quality delivered using digital as the lever. So if you look at it in terms of from where we have moved, and in the, I would say, last 3-4 years have literally been, I would say, fundamental. So the key things that we have been able to do, and we take that with all pride and humility, to say that what we achieved as a nation, what we achieved as a group, being able to touch, being able to have people at least access basic health. I'm not saying that the journey is done, but I would say the steps that we took. The steps that we took to basically have the primary health at least being accessible, something which people could at least afford or at least claim to have. Third is the entire push to say that healthcare is not something which is limited to only the metros. Like 75% of population lives outside that, but the quandary is that our health facilities are all concentrated towards the metro and the suburbs there. So how do we break that barrier? And the way I see it is digital is that fundamental, the lever, like what mobile did. Like just about imagine today, and we can't even imagine a world without a mobile, and not only, again, the people sitting here. So that's what the power is for digital. And digital is not just about saying that, okay, I was doing this in a manual fashion, can I use a tech? It's doing it in a fundamentally different, like what Prashant was mentioning morning, that what are some of those fundamental models of delivering care, that's where digital looks at. And the other point, which I'm not taking too much time because we have a lot of, I would say, thoughts to be discussed and shared, is the entire concept of the Bharat context. See, that's what I always say, that we can always be enamored, we can always be inspired, but ultimately what works and what's something which is successful, and I think there are enough use cases to say that frugal, that innovation, which is one of the topics that we will be discussing or talking about today, is that what is that frugal Bharat context that we talk about? Something which is not just about aping, something which can work, taking in today's context of whatever are the realities. And that's something which we have to live with. And saying all that without a mention about the huge push the government is, I would say, putting, and to name it the Ayushman Bharat Digital Mission, a huge effort, I would say, a huge ambition. You won't believe that we were there in another country, I'm not naming that, and we were talking about the magnitude of the ambition that ABDM talks about. It's immense. And that's something that we are all driven by. So digital is not just about saying that I'm using a technology to use for whatever means and mechanism. It's a fundamental way of saying that how am I delivering quality, accessible, affordable care, taking the entire equation out of where people are. And with that, I would like to basically involve my panel members. Starting with Girish, so one of the key things that when we are talking about, and that's something I'm taking the cue from the morning sessions, is the entire concept of remote care, about how do I make some of the care which is accessible. So where do you see some of the inherent technologies, be it 5G, be it some of the new age technologies, where do you think them breaking some of those barriers and literally, I think, powering us on that journey? So some of your initial thoughts on this. Thank you.
Thank you, Sayantan. Firstly, thanks for having me in this panel. It's a pleasure to be with this group of folks. So I think you touched upon a very important point about telephones and telecom reforms. It is very interesting to hear your perspective, right? I don't know how many of you here know about STD booths and know the long queues while in college waiting for making a call. I asked my son recently what is a telegram, and he opened his iPhone and showed me his telegram app, right? Those days when we were much younger, when we get a telegram at home, people will start crying, right, without knowing who passed away, right? So that is how telegrams were seen those days. So you can see from the 90s how the telephone reforms have drastically changed the way we communicate to a large extent. So taking a step forward, if you look at how digital health is going to transform healthcare, would be pretty much the same manner, right? Maybe 30 years from now, 20 years from now, in a similar panel discussion, people will be talking about how healthcare was in 2023, right? That is how we're going to see. So if you look at what digital health is going to solve today, are primarily two things. One is what Sayantan mentioned about accessibility, right? We have a huge challenge with accessibility of healthcare. We have a large population of people who are in rural places coming to urban cities for healthcare because we don't have good healthcare capabilities or the capacity in tier 2, tier 3 cities and so on and so forth. The other big challenge we're facing as a country is that we have a lot of folks coming out of poverty, and as they come out of poverty, we have a lot of propensity to pay. But unfortunately, our healthcare systems are not so elastic enough to expand and take more of these patients onto its folds, right? So that's precisely where the technology like 5G is going to help, right? 5G, when it's in full form, would be able to take care to the tier 2, tier 3, tier 4 cities. For sure, broadbands will never be able to get to a tier 4 city, tier 3 city, but 5G will definitely, right, following 4G. So I think with that, we will have a lot of capability for virtual care. Today, it's, we were talking this morning about Practo as an example. It's possible for somebody to log into Practo and do a video call with a doctor sitting somewhere in Bombay or Bangalore, and you get some good quality advices from the doctor. So that is where virtual care is going to make a big impact. The other area where, and 5G would definitely play a huge role as 5G gets into the tier 3, tier 4 cities. The other big space where we're going to see a huge impact of digital health is the clinical outcomes, right? The big challenge we're facing today is we don't have enough trained technologists or clinicians as much as we want, given the population we are having today. And digital is going to play a huge role where we are going to use technology to drastically normalize the quality of care. So using all the technologies on digital health A part of it is machine learning, AI, and so on and so forth, is going to provide insights to clinicians, physicians, to provide better quality of care. So the whole delivery model in the years ahead, maybe in 5 to 8 years from now, would be very different from what we're experiencing today because of digital health.
Yeah, thanks, Girish. I think very fundamental points you said, that the care model, some of the, I would say, business models for that matter, will not either exist or exist in a form, maybe we are not Nostradamus here to be predicting, but I think we would all have our 2 cents literally to be contributing on that. So just moving over to JK out here and I think I'll take the cue in terms of from what Girish alluded about, that one of the key things is that how does digital health help us breaking some of these barriers. Now you have a supply-demand constraint that will always exist in a country which is as diverse. Now, with all that in place, how and what, according to you, would be the key, I would say, drivers for digital health to be breaking these barriers? Looking at a more equitable model for us to be thinking that care is not just confined to certain clusters, certain areas, and how and what are your thoughts of how and what we would be doing on that? Thank you.
Thanks, Sayantan. It's a pleasure to be talking about this and also to be playing a little part in what digital healthcare could be in this country. It is, in a way, while I might be overstating it a bit, it is a silver bullet which is going to shape the future of healthcare in India. If you kind of look at healthcare as a category, it is one of those geo-fenced category, like a medicine written in Chennai wouldn't be available in Delhi. And most of the time, the hospitals, the diagnostics clinics, and the general healthcare ecosystem exist in a very unspoken geographical boundary. Like the topic of today kind of covers it. I think digital really can break the barrier, literally remove the fact that there is actually a boundary. Like, imagine a situation you kind of want to visit a doctor. You can literally have a conversation with a doctor from any part of the country. And I remember there was a point of time when my father used to go to the diagnostic center a night before the test to find out the instruction for his fasting blood sugar and also get the sterile containers. How many of us do it today? Somebody comes to your home, right? Like the care has come to the patient, and it is only going to go up as we expand. And one thing which I'm really proud about, the thing that I've done in the last few years is my 88-year-old grandmother who lives in like the remotest part of Tamil Nadu actually has her medicines delivered on Amazon Pharmacy every month. Otherwise, she would have to get somebody to do a 20-kilometer trek to get it. She gets it in front of her. And I had my last little consultation, I think a few weeks ago, and the doctor was from Bhopal. So you literally kind of can use digital to break the physical boundaries. And talking about the provider and patient dichotomy in India, if you look at urban India, it's pretty sorted. Like you are well within 1:1,000 ratio of patient to provider that you have for the WHO recommended one. But this ratio deteriorates pretty much to 4x if you go to rural. And the chief guest in the morning was also talking about the fact that you really need to be accessible to the poor. And if I really look at the chronic infections which are prevalent in India, India has about 250 million diabetic and pre-diabetic customers. And as per one of those recent reports, in rural part of the India, the doctors don't have access to basic diabetes medicines like metformin. And this can be a huge divide. And what I really feel digital healthcare bringing to the table is it can open up the whole ecosystem, pretty much make a guy who have a prescription from Asansol get medicine in Aurangabad, which wasn't possible, forget about a decade ago, it wasn't possible 5 years ago. You usually, most of us have experience of going to multiple places to find the same set of medicines. Today, you can pretty much get them at a click. The same thing with diagnostics, the same thing with doctor consultation. You've literally kind of opened the barriers, if you would like to call it that way. But now that I've taken you on a sinusoidal curve of what all can you do with it, how awesome the opportunity is, and how fantastically we are progressing, you also have to bring it back to ground on reality. There are a lot of issues which needs to be fixed for digital health to be what it can really be. The first one is inclusion. We spoke about it a lot today in the morning. Our technology really making it accessible for anyone and everyone. There is 5G, there is smartphone, which Girish spoke about, but how many people don't have access to that, and what is our solution for them? I think inclusion is a very important space, and my friend Suhel is going to speak a lot more about it. He's pretty passionate about it. And then comes the whole provider. So we all talk about patients. How many providers find it easy to use digital technology? Yeah, technology is not about how it looks; it is about how it works. How many doctors find digital ecosystem intuitive enough for them to comfortably deliver healthcare? And that's going to be a huge mountain to climb as well. The third thing is about how do you deliver trust to the customer? Like, I don't know, most of you guys might still feel like a teleconsultation is not exactly perfect, right? You go to a doctor, he looks at your eyes, he gives you a gentle squeeze onto your tummy. Only when a physical transaction or physical conversation happens, you feel like it's getting complete. Now, when you don't have access to that in teleconsultation, while it can be fast, amazingly accessible, primary care can be so fast that you can find a doctor in 5 minutes on most of these apps. But do you feel complete with the prognosis? So that's about creating trust with the customers. And the last part is something which we will take some time to get to, which is the data interoperability and security. You know, you talk about the fact that you had a health test at one place, a doctor consultation other place, medicine delivery in the third place. Is your health data interoperable between these, and are they talking to each other? And when you make them interoperable, which means it can travel anywhere, everywhere in the country, how do you protect customers' data? Which again, we can't take for granted. But well, it's not fun if it is easy. And I'm pretty sure people in this room and outside the room are going to make a lot of things happen that 5 to 10 years from now, digital health will be so much in the general conversation that you don't have a health consortium or a symposium for that. Thank you.
Thanks, Ricky. I think the way you articulated and I think the points with regards to trust, inclusion, very important points. And as we move on, I'm sure that we'll reflect them. So moving to Dr. Kapasi, so I'm sure that we would have heard about a lot of things, and just to take a stab at maybe demystifying some of the key things around data, around AI, around Web3. Now, and again, these are all things that I used it in the same breath, but every one of these has a different connotation. So maybe you can take a bit of, I would say, time for us to say that how and what each of these are doing, and what is that holds for that Bharat context that we are talking about. Over to you. Thank you.
Interesting, na, Sayantan, you asked the only non-engineer here to answer about tech. So yeah, let me take a stab at it. So I've been very bullish on Web3 as a technology. I mean, after an MBA from Wharton Finance, I still don't understand what is happening in the crypto world. But blockchain as a technology is something that I believe has the potential to solve what Jaya just mentioned in terms of security. I mean, we all have seen the billboards that Apple has put up, right? The black ones talking about health data security through the Apple Watch. I mean, I was very surprised when they came out with that positioning, you know. But it made my life very easy when we started talking about, because we have been talking about health data security and health data being a very sensitive form of data with a lot of leakage points. Now for what, around 10 years odd? And how there are different technologies that can actually help in solving that particular problem. Now with Apple coming out with that positioning, it really did make our life easy, because people started really thinking of it as a major problem. So I think the Web3 technologies like blockchain, for example, has the potential to be able to have a rather more secure, more interoperable approach towards the technology and data storage structures that we have right now. So adding to, and I think G has done a great job in the device industry as well, and the kind of work that they have done in POC devices and last mile delivery. I think that is fantastic work that has happened around. So one of the things that I wanted to add to accessibility and affordability in care is something that we haven't really spoken much about, is accuracy. Accuracy of care delivery, accuracy of clinical decision making. I think ABDM is an amazing tool that the government has developed, an amazing system and an ecosystem that is now being operational, and I'm sure the next speaker is someone who has worked really, really hard in making that happen. But the point is that one of the things that we are missing is the kind of gaps that these data still have. One of the major gaps that I believe that exists in reaching something which, you know, is the holy grail of AI in healthcare, which is autonomous diagnosis, which I'm sure you know IBM has tried through the Watson program, and now they are retrying with the Watson X program, which Babylon was in effect, was an attempt to by the NHS as well. But the reason why this did not come out as well, actually, is because clinical decision, what a doctor thinks, and I have been a clinician for some time of my life, a while ago, but yeah, I was one a while ago. But when a patient comes to me and when I listen to the symptoms and then when I write a prescription, what is the thought that goes between those two things? When the patient comes and says कि मुझे सिर में दर्द हो रहा है, मुझे पेट में दर्द हो रहा है, I'm feeling dizzy. This is something that happened to me on the way here. My driver said to me that I'm feeling dizzy on occasions. Right? I did not have time to take the entire history, but it looks like a hypertensive case of positional hypertension. Now, the point is that what happened in my head to connect those two things? That is something that's not captured in most data sets. And until and unless we make our EMR strong enough to capture those decisions, micro decisions and decision making trees, we won't be able to go to the actual, as I mentioned, the holy grail of AI in healthcare, which is autonomous diagnosis. And why do we need that? We need that because that is going to achieve the 3 goals of digital care, which is affordability, accessibility, but also accuracy. And I think that is my summation on all of these 3 areas. Of course, there's a lot more that is happening out there, and I'm sure the esteemed engineers here could throw far more light on it, or technologists rather. But this is, as a clinician, my summation on these 3 things. Apart from that, I wanted to just add that what you guys had mentioned about the digital architecture is extremely important. You know, today we talk about India being developed because we have the right, one of the major things I remember, there is this, so I'm a TV buff, okay? And there's this one series that I really enjoy called The West Wing. There is one dialogue in that which I really like, which says that what do you want to do if you want to give medicines to Africa? And this was in 1999. They said build roads in Africa. The reason why is supply chain and building the right ecosystem is very, very important, which both my esteemed colleagues are being a part of. Today we are in a place where we need to build those digital ecosystems, right? That is going to be the backbone of development and technology delivery across. And on that note.
Thank you. And I think, Suhel, moving on to Hugh, I think few of the key things that we have been speaking about. I think maybe with all the work that the Gates Foundation is doing, and especially so if you can throw some lights that on ground, what are some of the regulators, what are some of the institutions actually working towards making it a reality? Because all these things needs a very strong ecosystem institution to be developed. So that's something which you're enabling, and you're really at the front and center of it. So over to you to throw some light on it. Thank you.
Okay, thank you. I actually want to start with few clarifications. First of all, I'm not here to preach. I have a bunch of requests which I'm going to place to everyone in the room. I don't think I qualify to preach on anything at this point of time. Second, with all due credit to our partner ecosystem that we work with, the real ground level work that you're referring to is being done by our partners. So we are still one step away from what really happens and that's good and bad. We try and spend as much time as we can just going to the field with our partners, meeting the beneficiaries that we care about. So it gives us a sense of what it really means. And I'll state a few examples because my request list is slightly longer than I had initially planned for. Let me start just with this point that thankfully the Minister of State himself set the tone for, which is inclusion. 2 decades back, we were starting the journey of being a tech powerhouse globally, but for a very long time, we were basically a cost arbitrage proposition country. And it was very restricted to services as a business. So it was IT services which were essentially leading that component itself of our growth. Today, I think confidently I can say, being part of that journey, seen many things unwrap over the last decade or so. We are building products, and many of you in the room have developed those products, are leading those initiatives, the innovation that is going behind. We genuinely are in a very, very different sphere where we have the ability to not solve just the problems we have in our own country, but also for rest of the world. But let's be clear, India for the world is not a story only about what we can gain, it's also about what we can give. So there's a clear opportunity, and that's where the request comes in, that please think about the bottom of the pyramid, not just from the perspective of the economic lens. Many times we just talk about the economic lens itself, but the vulnerable population includes various different people through different lenses of vulnerabilities. And I would just request that everyone thinks hard on what they are doing. How does it serve some part of that vulnerable population? I tend to take these opportunities and these platforms because of the fact that we are talking about humongous amount of brain power that comes together. In this room today, we'll spend a few thousand person hours. I think it's worth coming out with very clear, actionable. Again, very thankful that the minister was seeking those inputs from this audience, right? And unless until by the end of the day, we have those 8-10 points to take to the government, to various other stakeholders in the ecosystem, or to organization like ours, right? We are a philanthropic capital organization. We believe we can bridge certain gaps. This event will not be successful in my view. So I'll request again everyone, please jot down what do you want from the government, from organization like ours, from the industry, from your peer group, to make certain things happen which you would wanting to do but not being able to do. I am also not a very ideal utopian thinking person. I am not against capitalism. There are many people in this room who necessarily don't come from a not-for-profit organization. That's perfectly fine. And that's where I feel these gaps can be addressed, and which is why I said, philanthropic capital is best used in bridging such gaps. So please come out with ideas that can solve these problems. Sorry, I'm just going to refer to a few points raised by the other panelists, and this was not scripted, so they are also not prepared. So Girish talked about the telecom revolution, and I'm just going to give examples of what we can do, right? So yes, we have 5G rolled out. All of us, I'm sure, still face these blind spots, even staying in metros. I don't know how many of you travel to villages. You don't even have to travel to villages actually. Go to tier 3 city and below. You may not even find 4G in many places. So forget 5G right now. What can we do with that problem? Just one example I'm taking. Can we create a broadband-based public Wi-Fi entrepreneurship systems which work well enough for the users to pay very small amounts of money to get that internet connectivity that they're looking for? Is that a feasible option? And by the way, again, no utopian talk, these models exist. So how can we leverage that? Jay talked about the penetration that has happened on the delivery side, and you can pick anything today. It's been a great story. Today, even at my home, I think all of us can relate to this. Even 5-6 years back, if we had to order a meal, we will spend half an hour having consensus within the family, what cuisine and what do we want to order. Nobody cares today, right? Today we just order the respective dishes we want to have in the family, and that's how the ordering happens. So the pharmacy example is a great example, but I'm sure even the largest of e-pharmacies in India today have less than 50% of the PIN codes being served. I'll be very happy to be proven wrong. There is clearly a lack of business case today for them to go beyond that. Can we create models here which can create a more value proposition is clearer for them to invest in that? That's the thinking which is required. I'm pretty sure whether it's Amazon or Tata 1mg or any other e-pharmacy that exists would love to do that. There was another very interesting point that Jay raised around the teleconsultation bit of it. I think fair point. Another area that we really need to invest in is how do we look at diagnostic convergence? Let's be practical, right? We're not going to solve the shortage of doctors in the near term, at least. We will be at a really, really bad ratio compared to what WHO prescribes. We are not going to be close to that. So we can't take the doctors out there to each village of this country. But can we take the diagnosis and that convergence with teleconsultation platforms? I think it's a very real possibility. And bringing the connectivity play again, something we should definitely look for. I just also want to highlight something that was talked about from a Ayushman Bharat Digital Mission perspective. And here is where I feel there are multiple ways for all of us to contribute, both as individuals and the organizations that we represent. There was a reference earlier on the number of Aabha, which is Ayushman Bharat Health Account or your Health ID if you want to call it simplistically. So 40 plus crores issued. Can I just, by raise of hands, how many of you have Aabhas? Okay, great. How many of you have helped someone else create an Aabha? So just imagine this 40 crore people just help one more person to create Aabha. How much time do you think we'll need to cover the entire population? Can we take out 5 minutes to create an Aabha of somebody who comes to our house, one of the healths that we have, or somebody who works in our office? Can we just do that? 5 minutes, right? I'm sure that's not a big ask. So that's another request I have. We just help create Aabhas. Once we've created Aabhas, how many of you have seen the utility of Aabha? Reluctant hands. That's the next step. There's no point having these Aabhas, there's no point having these ABDM or Aabha-linked records unless until these records translate to getting that information on a health locker. And today there are umpteen options for you to choose from. Please create a health locker, get your data records into the locker itself. I see Vikram sitting here, so I'm not going to spend more time on ABDM. He will cover it. But I'm just saying small things that we can do. Even as organizations, and assuming that most of you sitting here do have some linkage to digital health piece of work which is happening, please ensure that you are going through the sandbox process, getting the ABDM compliance done. You can have multiple questions. Why should I do that at this point of time? It's almost the same question that many of us had 13 years back. Why should I have an Aadhaar? Nobody questions that today, right? We are at the foundational level of building something that no other country has attempted. Yes, it's an extremely ambitious goal, completely unprecedented, but we have enough success stories from Aadhaar to UPI. I mean, I can come up with a very long list of things that we have done. One last thing I want to just reconfirm, which you will hear from many, many people. As Gates Foundation, one big advantage we have, we believe, is the vantage point we have. We work across multiple LMICs, we work with global institutions, so there's a very good visibility that we carry on where other countries are, especially LMICs. I can assure you, today, as we speak, we are not even just years ahead, we are possibly decades ahead of many countries including developed countries on some of these initiatives. All that really is important is this is not about the 100, 200, 300, 400 million customers that you may have on your platforms. It's also about the 1.4 billion people which is in the country, as well as the population, other LMICs that we need to cater to. So let's not forget them. I'll pause here. Thank you.
Thanks, Suhel. I think the call for action was really something which is literally a rallying point, because end of the day, what we have been talking about, it's for each of us to think, contemplate, contribute, and then move forward. And that's what I would say makes a success for any of these, I would say, congregation of thoughts, as you mentioned. So I think we have some time in terms of, maybe we'll keep it for some question answers, because I think we have had lots of thoughts being, I would say, shared, exchange and all, and some of the thoughts which have been basically something which I'm sure like stirred up some of your thoughts and ideas. So we'll be happy to, as a panel, take any questions, any remarks, anything that you would like to discuss about. Open to it. Maybe we can have the mic there. And you may please mention if there's someone in the panel you would like to address it to. Yeah. We have.
Yeah, hi. This is Sukant Khurana. I actually now run a startup on epilepsy and few other startups in US and in India. Otherwise, I was a professor earlier in US and now in India, briefly until 4 years ago. So my take, one of the things that I noticed, especially that I spent almost 10 years in Texas, and what is different in India is there are more silos. So there are a lot of efforts. Like there are wonderful not-for-profits in, let's say, the mental health area which I work in. There are academicians which are scattered. There are government initiatives. Then there are for-profit initiatives. But integration is something which is missing. Like when I was in Texas, we were doing things for Alzheimer's. We all used to come together under both a physical and virtual umbrella to exchange ideas and to even sync. I mean, sometimes there are competitions in for-profit and you cannot completely cooperate. But by and large, cooperation is possible when the space such as India, where the unmet need is so high. So I want to ask this question to everyone. And in fact, one of the things that I've seen, like until 2018, I was a professor in India. From 14, I said Kolkata, CDRI and all. And then I realized I'm not getting what I wanted. But what I see is labels. So for example, I do a lot of not-for-profit work. But since I'm running a for-profit, they're like, okay, so what are you making out of it? Right? So the idea that you have to fit in one category only is something which I think needs to be broken. And I would like to ask everyone, especially Gates Foundation representative here, to address that.
No, first of all, thank you so much for raising this issue. I come from a consulting background. 15 years I spent in the consulting space. Couldn't agree more with the challenges that you've called out. And I think it has to be a very conscious, deliberate efforts. There'll be some challenges which are also from a legal standpoint, which we have to figure out ways to overcome. I mean, just in the context of India, obviously, there's limitation to a certain extent on who can receive money from us directly. But I'm sure we'll have to figure out ways, and government is being extremely supportive on that thought process. A quick response to your question, at least we are very clear. We don't, as Gates Foundation, see that differentiation. In fact, a great example I want to call out is we released a global grant challenge on AI, equitable AI, in May this year. 75% of the organizations that submitted their proposals were from LMICs, 40% plus private sector. For-profit organizations. It's actually a very big shift from a typical grant challenge that we would have released in the past. And that's something which is very encouraging. We would love to just continue to support in that mode. But no shortcuts on coming together, synergizing as much as possible. Cooperativeness is what we should be looking for.
Anyone else? Take a stab at it.
Actually, it's kind of slightly tangential to what you're talking about, especially on silos. Because if you kind of look at digital health, it's possibly an opportunity to kind of break the silos, because healthcare is a journey, is a continuum. It's a longitudinal journey. The doctor kind of creates the need for medicine, and the doctor also creates a need for diagnostics, and this thing kind of keeps going in circle. And one way all of this, while I said India is very fragmented, you could see it in every part of healthcare, be it hospitals, be it pharmacies, be it diagnostics. A way to bring them together and tie them up into a continuum could potentially kind of solve a bit of what you were talking about as well. Like, are you bringing the right minds who are solving different problems in different spaces to come together to put the pieces together? And one fascinating idea that I keep always talking about is the concept of family doctors. Every family used to have a family doctor a decade or a decade and a half ago. We've literally forgotten that idea. And what these family doctors did is, they knew about your family health history, which means they had health data of you pretty much stored in their head. May not be the perfect numbers, but they knew who had diabetes, who had blood pressure in your family. And they literally were available for you to call them anytime you wanted to. And I personally feel like a big breakthrough could happen in digital health when you can put a digital doctor and digital data storage pretty much in the same way a family doctor operated, pretty much at the press of a button or in your phone, traveling along with you. So in a way, digital itself will kind of bring the silos, break the ice, and merge them into one long healthcare continuum.
Okay, I think so. We have almost time up, so I don't know if there are any questions. Else, I'm sure that we'll be available to take those questions in the breakout sessions and all. But overall, I think, do we take the last question? There's a lady.
Ma'am, I'll encourage you all to have conversations offline.
Okay, fine. That's apologies for that. It's always, so when you stir up the pot literally with ideas and thoughts, I'm sure that a topic like this, but I think it's been a session which hopefully has been able to, as I use the phrase, stir up the pot, get you to think, and most importantly, think and contribute what is that you would be doing and what is that you think will be the critical, I would say, success factors to make digital health a reality in India. Thank you. Thanks once again for all the panel members for, I would say, participation, and for you being a lovely audience. Thank you once again.
I'll request you all to take a picture together for us. And terribly sorry, I know you all have a lot of questions, but I'll encourage you all to take them offline. We have the networking area outside. I'm sure the speakers and all the panelists would be very happy to take the questions off the stage. So kindly do so. And once again, thank you so much, Mr. Raghavan, Mr. Bidani, Mr. Jai Ramakrishnan, Dr. Kapasi, and Mr. Chatterjee for that wonderful session. Thank you. Let's have a round of applause for the panel once again. With this, we're moving on to our next conversation, and for that, I would like to call upon Mr. Jaspal Singh Riyad, Director, Corporate Business Development and Strategy for Microsoft, to moderate, and I'll request Shri Vikram Pagaria, Joint Director, National Health Authority, to join us as well, to share the perspective on implementing Ayushman Bharat Digital Mission for better data accessibility for governance and research. Well, our chief guest also spoke on Ayushman Bharat, and I'm sure you all are looking forward to this fabulous conversation, as are we. Have a time limitation here. We have some amazing conversations to continue later on in the day. So keeping all of that in mind, if you do not get an opportunity to ask your questions, as I said, we have a networking area outside. Please make sure that you reach out to your panelists, your speakers, and put up your questions. They'll be more than happy to accommodate all the questions that they can. And with that, I think it's time I invite Mr. Jaspal Singh Riyad along with Shri Vikram Pagaria. Let's have a huge round of applause for these two. There's a thing There's a thing, I don't know if you know it or not, but if you clap, it's very good for your heart. I'm sure some doctors have told you that, haven't they? Let's exercise that a little bit more. Thank you. Wonderful.
Good morning, everyone. Up today, especially when we saw like a lot of rain in the morning hours. Okay. So I think this is going to be a very important topic, ABDM, right? Whatever that we are discussing today, I think there is a huge momentum that's already in place through ABDM that is from NHS side. And whatever transformations that you have seen in a lot of other industries, including fintech, right? ABDM has got a big role to play. And we have got a very important guest today to talk about how the journey has been, what are the new initiatives NHA is building, right, for next couple of years to ensure that we are actually going to get into the next momentum of bringing healthcare industry into the same league where we have seen fintech, like where we are one of the leading country in the world now in driving to close to 12 billion transactions per month, right? So I got Vikram Pagaria. He's Joint Director in NHA, and he's currently responsible to drive the whole coordination effort that's required to build the ecosystems together, including driving the adoption of whatever NHA is actually building, plus the whole capacity building exercise. So, Mr. Vikram, while we talk about today's theme of the conversation, that whatever platform initiative that NHA is driving, connecting the whole ecosystems together, and the theme is that accessibility to drive innovations for research as well as building policies for the government. But before you go there, just can you briefly talk about how the 360 initiative of the government through NHA over last 3 years since it's being launched, right, is helping the ecosystem to drive the adoption, and what are the milestones that NHA has achieved till now?
Yeah, thank you, Jaspal. So the Ayushman Bharat Digital Mission was launched as a pilot in the 6 union territories of the country on 15th August 2020. And 1 year later, in September 2021, it was launched nationwide. So it is close to about 2 years that this mission is being running. We have launched we already have a publicly available dashboard where about 40 crore people have ABHA IDs, and around 200,000 facilities and 200,000 health professionals are on our HPR and HFR. We have about 110 players who have integrated their APIs with us, which comprise both the government programs like the CoWIN, PMJY, National Non-Communicable Disease Program, NICSHE program, as well as various private players. For example, Practo and Pristine are there on the screen. They have also integrated with us. What this mission of Ayushman Bharat Digital Mission, the main mission is to create a national digital health ecosystem, is to and to promote interoperability. So one of the main use case that we want to implement using ABDM is that when a patient goes to a hospital and the doctor over there asks, can I see your past records? And if the patient says yes, then all the past record, all the longitudinal health records or all the medical records that are there, immediately they come on the screen of the doctor, and the patient is not required to carry that polythene or bag of records. That is the kind of thing that we are visualizing as of now. We have been able to do it in some pockets, but there is a long way to go. Yeah.
So looking into future now, like when you look at the ABDM's effort for next, say, 3 to 5 years, and when I recently read Niti Aayog's report that, the effort is such a huge implications like on India's economy that close to $200 billion of economic value that India actually can generate in next 10 years through ABDM itself, the efficiencies that we can build. So what kind of targets NHA is keeping itself like for India in terms of building the robust HPRs, the healthcare professional registries, healthcare facility registries, right? And of course, like the ABHA adoptions, that 40 crore that we have seen now. Ideally, you would like to cover it for the complete population. That's one. And second is, I know that it's not an easy journey. And what are challenges that you actually foresee to reach to a specific targets the government has kept in its mind right now?
Yeah. Presently, in Ayushman Bharat Digital Mission, we are focusing on creating the building blocks. So whenever, if we imagine a building, first we need to have the bricks and the cement and the base work, the foundational work that is required for a digital health ecosystem which is interoperable. So our main motive has been to create this foundational, to create this building blocks, and our main focus is on how to populate these registries of healthcare professionals, how to populate this registry of healthcare facilities. In COVID time, there were a lot of requirement that of the number of healthcare professionals, the number of healthcare facilities, and India unfortunately did not have a very credible data. We had some data, but that was also not updated. So it was imagined that we should have a up-to-date data of healthcare facilities, which we call as the healthcare facility registry, and the healthcare professional registry, which is the HPR. For private sector, also we want to promote the use of these registries just in the way of, just in the same way like the KYC services are being used. So know your customer services through Aadhaar, you give your OTP and you are identified. Similarly, we are trying to promote the use of KYD, know your doctor, and KYF, know your facility, know your healthcare facility services. For example, Practo, it has to onboard a number of doctors. So various doctors would sign on Practo. How would Practo know that this doctor who is signing on me is a verified doctor or not? So what would Practo do is Practo would send an email to them saying that please send me your council form, please send me your MBBS degree, and some people, they may fudge those documents, and then and the second point is the process is entirely manual. What we are building in ABDM is these digital public goods which are for use for the entire country. So any private company which wants to say use our identification services for doctors or for a facility, we are trying to we have our APIs which are open, and any company can utilize those doctors and say that, oh, this doctor is a real doctor or is a quack. Because for our doctors to be listed on the HPR, we do a detailed verification process. So right now our main focus is on how do we populate these registries and how do we do the first step of installing some software in our healthcare facilities. And we have been struggling in NHA to decide whether we should go to the mandate mode or through the incentives mode to make it to motivate the ecosystem to adopt on its own. Nobody has asked us to use UPI, right? We all use UPI because we know the advantage of it. Similarly, what we at NHA are shifting our focus, or we are more inclined towards providing incentives, providing motivation to the citizens as well as healthcare providers to use ABDM and ABDM related functionalities, rather than saying that all beds, all hospitals with more than 100 beds, they have to be digitized by such and such date. So we have also started a health incentive scheme, digital health incentive scheme we call it as, since January 2023, where we are providing 20 rupees to each hospital for making an interoperable digital record, and we are providing 5 rupees to each software company for making that record. So we are trying to create a strong value proposition in terms of ABDM.
So quickly coming back on the challenges, like
Yeah.
if you see over last 3 years, and even when you look at the statistics on the number side, right, it's mostly the public sector health facilities where we have seen the adoption, and private sector, I think, is still a long way to go. So what are the challenges that you see actually? Why the adoption has been slow, and how you are thinking that, okay, when you're building plan for next 3 to 5 years, whatever feedback that you are getting, because you are managing those relationships right now with almost all the entities, right?
Right.
You're trying to get through that.
Yeah. So private sector is very important for us. 70% of our healthcare is being delivered by the private sector. One of the main challenge that we face while interacting with the private sector is that it is not inclined towards NHA's motive of interoperability. Narayana Hridayalaya, Manipal Hospital, and Fortis Hospital, Max Hospital, Medanta Hospital, we had a series of conversations, but they say that NHA is about interoperability, and if we promote interoperability, then patient would never come back to the same hospital. The patient can go to any other hospital. So that value proposition for private hospitals, what we also find is that this is the main challenge that we think. It is good for the citizen, it is good for the government, because they would get an entire view of the aggregated and anonymized data. But for the private sector to be motivated to provide interoperable solutions to the citizens has been our main challenge.
So I think switching gears to the whole data accessibility point itself, right?
Yeah.
Once the data is ingested, data is available to patients, or you call it consumers, right? How actually you are trying to create demand cases, right? How you are trying to generate demand from customers. I think that's going to be one of your key unique selling point. If demand is also there, I think there is a big way that, okay, it starts from public sector, but there is going to be a cascading effect to the larger other industry ecosystem. So how you are trying to solve it?
So absolutely, I think that is a focus that NHA is starting to give in a very conscious and a very dedicated direction. So in October 2022, we launched something which is called as the Scan and Share OPD registration service. So when we go to these public hospitals, there is a lot of queue. And given that our country is very well versed with QR codes, what we started is a QR code which is put on these public hospitals, a separate counter or at various places where a patient can scan the QR code from any app. They can use from any app which is ABDM enabled. They can use the Arogya Setu app, they can use the Abha app, they can use Paytm, they can use Eka Care, they can use Briefcase and various other apps, and they can scan the QR code. So what happens when they scan the QR code, my name Vikram Pagaria, my age, my mobile number, my address, all the demographic details that are already there on my health ID, it gets communicated to the HMIS, to the hospital software, and I get a token number 42. So when my token number 42 comes, I go to the doctor and say that, oh, I have a pain in my hand, and I would have to visit maybe an orthopedic or a general medicine, and then they would immediately write that and give it to the patient. So this this token service that we have started has crossed about 50 lakhs, mostly in public hospitals. But this is one of the use case that we are thinking of a person who has an ABHA. If a person has an ABHA, how does that having an ABHA would help him or her? So all the pain points that are there. For example, why can't we have at the pharmacy you go and you scan your QR code and you are able to take out a medical record from your health locker and provide it to the pharmacist. Or when you are starting from your home, you can send your prescriptions to a pharmacy, or through an e-pharmacy you can send your prescription. So addressing those pain points and providing some benefit to the end users would help in creation of demand, and since the demand side would be there, then supply would come.
Okay. So I think you are trying to bring the learnings from the world of UPI, that scan the QR code, and that same is now going to be applicable for your healthcare needs, right? Especially reducing the waiting time in the OPD, right?
Yes.
So quickly, I think switching gears to the data accessibility point, I think one, of course, is leveraging the data once the ecosystem is robust enough. You want to leverage that for various type of research as well as for building your government healthcare plans, right, policies. But before that, there is a concern that it is around data privacy, security, data theft issues, right? And that's also one of the key blocking point, right, for industry. So what is, how NHA is actually trying to handle this? Because that's going to be something that need to be, closely looked into to build a confidence that, yeah, ecosystem is now ready to adopt it.
Yeah, I think one of the main features of ABDM is its focus towards data security and privacy. The National Digital Health Blueprint, it is a 72-pager document which is available on our website. I think it is really visionary because it provided an interoperable ecosystem in a manner which takes care of privacy and security. So our mission is mission's main feature is its federal architecture. So federal data architecture means that I go to Apollo Hospital, my report is with Apollo Hospital. It is not with the government. And the next day, suppose I go to AIIMS Delhi, and the AIIMS Delhi doctor says that, can I see your pharmacy, your lab report? And if I say yes, the record travels from that SRL laboratory to AIIMS Delhi. So government is not storing any record, it is just facilitating the exchange. And this exchange also happens only when consent is given. So
Okay.
these are some of the ways in which we are ensuring. We also have a health data management policy which we follow. We are increasingly in touch with the Ministry of Electronics and Information Technology, so that this personal data protection bill, if it gets passed, it would be very convenient and it would be very beneficial for the entire health ecosystem, as it would give clear-cut directions on data privacy.
Okay.
Yeah.
So on governance and research, right? So how government is actually thinking about to leverage this data?
Yeah. So to be very honest, till now we have about 28 crore health records which are linked to ABHA.
Yes.
As I had mentioned that the government does not store these records, what we can do and what we imagine in our minds to do, because still as of now we have not gone ahead and have done anything about data as of now. So what we are thinking about is that we will provide free anonymizers and aggregators as free tools to the hospitals. So for example, Apollo Hospital, we will give an anonymizer. At the end of the day, they would send us the details of the number of, say, persons who came to Apollo hospitals, their age groups, the kind of diseases that they report. So if that data comes, then we will aggregate it all and show it on our on the map and
Dashboards,
using
right?
that system. Yeah.
Okay. So I think, we'll just take one more question, So on the engagement side, right, how you are looking at to engage the private sector here, especially like startups, the external research-based companies, right, the healthcare companies also who wants to leverage the data. One, of course, is like access by NHA to build its own plan, but there is a world outside, right? So how you're thinking to, build access to that, which is actually going to drive productivity and helps the ecosystem if the data access is there, right?
Yeah.
So how you're trying to engage the ecosystem here?
So as I mentioned, Jaspal, right now we have not been able to start any work on providing this data and making available this data access because we do not have that data, frankly speaking. But this is one area which we have decided to focus on, and maybe in the future we will think about that. But for private sector as a whole, what we are trying to do is we are participating in conferences like these and taking their inputs as to how do we, if they have any inputs and if they have any suggestions, and how do we create more awareness about it, and if there are any suggestions as to how this can be improved. We are we have our eyes and windows open for suggestions. That is what I can say at the moment. Yeah.
All right, thank you.
Yeah.
So we are almost at the fag end, but I think we can still take max two questions. Yeah. So I think you can start. Yeah. One question. Yeah.
Can we have a mic towards the gentleman, please?
Thank you for the session, Mr. Vikram. Myself, Dr. Adil. It's been 6 years in the health tech space as a physician, entrepreneur, and the product manager. I have a question. As you said, there's a challenge among the private hospitals that interoperability will lead to patients switching the hospitals. And you said that there are initiatives which you are trying to create a demand and then the supply will come. But the initiative like scan and share in public hospitals, how will it lead to supply in private hospitals?
Absolutely. It will not lead to it. It's mostly for the public sector. What we are thinking as of now, we are working with Tata 1mg and another company named eVital in the pharmacy space as to how do we address some pain points. What we know from them and also our prior experience is that the maximum time that takes that the delay occurs in dispensing the medicines is when the pharmacist gets the prescription and the time he or she takes to take out the medicine from their store and give back to us. So if we are working alongside the private sector to find out, is it possible that if I start from my home, I send the prescription to a nearby pharmacy, and so that the prescription is sent in real time, and when I reach the pharmacy store, the prescription, the medicines are available and I can pick it up. So thinking about how we can address those pain points, not in the public sector, in the entire healthcare chain, wherever there are pain points, can we address them? Another use case that we are thinking is, suppose you go to a hospital and the doctor writes a laboratory test also to you and writes some prescription, some medicines also to you. What you do is when you come out in the lobby, there is a digital board or a physical board which has some QR codes for nearby facilities. So you send your, you scan the QR code, you send your prescription to the pharmacy, and you go and do your lab test. And after you go and do the lab test, you go to the pharmacy and your medicines are there. So we are studying the ecosystem closely, identifying which pain points can we address, and we are trying to create that demand in the ecosystem.
Fair enough. Thank you.
Okay, I think we have to, due to paucity of time, we have to end this session here itself. Mr. Bikram is actually going to be around, after this. You can take questions offline. A round of applause to Mr. Bikram, for sharing his insights, what is happening in NHA. Thank you so much.
Gentlemen, I'll request you to take a picture with us. Thank you, Mr. Riyad. Thank you, Mr. Pagaria.